Drugs that act on the CNS in mid-school pharmacology. Understanding local anesthetics, mechanism of action, nerve fiber response, pharmacokinetics, systemic toxicity, structure, and clinical applications. Introduction. Local anesthetics are essential drugs used to produce reversible loss of sensation in a specific area of the body. Understanding their mechanism of action, nerve fiber response, pharmacokinetics, and other key aspects is crucial for safe and effective clinical use. This section will delve into the intricate details of local anesthetics, covering various aspects ranging from their molecular structure to clinical applications. 1. Mechanism of action. Local anesthetics act by blocking nerve conduction, specifically by inhibiting the influx of sodium ions through voltage-gated sodium channels in nerve cell membranes. This occurs in a use-dependent manner, meaning that the drugs have a higher affinity for channels that are frequently activated. 2. Nerve fiber types and response. Nerve fibers are classified into A, B, and C fibers based on their diameter and conduction velocity. Fibers are further divided into alpha, beta, and gamma fibers. Local anesthetics have differential effects on these fibers, with smaller diameter and unmyelinated fibers, C fibers, being more susceptible to blockade than larger diameter and myelinated fibers, fibers. 3. Pharmacokinetics and pharmacodynamics. A. Onset time asterisk. Onset time is influenced by factors such as drug concentration, lipid solubility, and pKa, acid dissociation constant. The higher the lipid solubility and lower the pKa, the faster the onset of action. B. Duration asterisk. Duration is influenced by the degree of protein binding, lipid solubility, and the presence of vasoconstrictors. Protein-bound drugs have a longer duration, while vasoconstrictors can prolong the action by delaying systemic absorption. C. Potency asterisk. Potency is determined by the lipid solubility of the drug. More lipid-soluble drugs are more potent, requiring lower concentrations for effective blockade. 4. Local anesthetic systemic toxicity, LAST. LAST can occur when excessive amounts of local anesthetics are absorbed into the systemic circulation. Symptoms include CNS excitation followed by depression, cardiovascular collapse, and, in severe cases, seizures. Treatment involves supportive measures, lipid emulsion therapy, and, if necessary, advanced cardiac life support. 5. Structure and classes. The prototypical local anesthetic molecule consists of an aromatic ring, intermediate linkage, and an amine group. Local anesthetics are classified into two main groups, esters, e.g., procaine, and amides, e.g., lidocaine. 6. Voltage-gated sodium channel structure. Voltage-gated sodium channels consist of multiple subunits. Local anesthetics bind to specific regions within the channel pore, blocking sodium influx and preventing action potential propagation. 7. Additives to local anesthetics. Common additives include vasoconstrictors, e.g., epinephrine, which prolong the action of local anesthetics by reducing systemic absorption and enhancing their effectiveness. 8. Clinical uses. Local anesthetics find widespread use in various medical fields, including dentistry, surgery, obstetrics, and pain management. They are employed for procedures ranging from minor dental work to major surgical interventions. Conclusion. In conclusion, local anesthetics play a crucial role in modern medicine, providing effective pain relief and anesthesia for a wide range of medical procedures. Understanding their mechanism of action, interaction with nerve fibers, pharmacokinetics, potential toxicity, and clinical applications is essential for healthcare professionals to ensure their safe and judicious use in diverse clinical scenarios. Understanding general anesthetics, mechanisms, effects, and considerations. Introduction. General anesthetics are essential components of modern medicine, providing a state of reversible unconsciousness to facilitate surgical procedures. Their use involves a complex interplay of pharmacological mechanisms impacting the central nervous system, cardiovascular system, and pulmonary function. This section will delve into key aspects of general anesthetics, addressing their relationship with lipid solubility, potency, and onset of action, the role of GABA agonists, MAC, and its utility. Hemodynamic and pulmonary consequences, appropriate volatile anesthetics for mask induction, genetic transmission of malignant hyperthermia, receptor activation for 4 anesthetics, and hemodynamic changes associated with each. 1. Relationship between lipid solubility, potency, and onset of action. Volatile anesthetics exert their effects on the central nervous system by interacting with lipid membranes. Lipid solubility is directly proportional to potency and inversely proportional to the onset of action. Higher lipid solubility enhances potency and speeds up the onset of action. 2. GABA agonists and neurotransmission. Gamma-aminobutyric acid, GABA, is an inhibitory neurotransmitter. GABA agonists, such as general anesthetics, enhance GABAergic activity, leading to an influx of chloride ions, hyperpolarization, and reduced likelihood of neuronal firing. This results in CNS depression and sedation. 3. MAC, minimal alveolar concentration, and its utility. MAC represents the concentration of an inhaled anesthetic required to prevent movement in response to a noxious stimulus in 50% of patients. It serves as a measure of anesthetic potency. Lower MAC values indicate higher potency, while higher values imply lower potency. 4. Hemodynamic and pulmonary consequences. Volatile anesthetics can cause dose-dependent depression of myocardial contractility, leading to decreased cardiac output. They also induce vasodilation, resulting in hypotension. Pulmonary effects include respiratory depression, bronchodilation, and a reduction in the ventilatory response to hypercapnia. 5. Appropriate volatile anesthetic for mask induction. Desflurane is often chosen for mask induction due to its low blood gas solubility, allowing for rapid onset and offset of anesthesia. Its low solubility in blood minimizes the time needed for equilibration between the alveoli and the brain. 6. Genetic transmission of malignant hyperthermia. Malignant hyperthermia is a rare but life-threatening reaction to certain anesthetics, including volatile agents. It has a genetic basis, commonly associated with mutations in the ryanodine receptor gene, RYR1. Triggers include exposure to volatile anesthetics and succinylcholine. Treatment involves prompt discontinuation of triggering agents and administration of dantrolene. 7. Receptor activation for 4 anesthetics. Propofol enhances GABAergic activity, leading to CNS depression. Etomidate acts on the gamma-aminobutyric acid A, GABA-A, receptor, similar to barbiturates. Ketamine is an N-methyldiaspartate, NMDA, receptor antagonist. Dexmedetomidine stimulates alpha-2 adrenergic receptors. 8. Hemodynamic changes with 4 anesthetics. Propofol and etomidate cause vasodilation, leading to hypotension. Ketamine, as a sympathomimetic, may increase heart rate and blood pressure. Dexmedetomidine induces bradycardia and hypotension. Conclusion. Understanding the pharmacological intricacies of general anesthetics is vital for anesthesiologists and healthcare providers. The relationship between lipid solubility, potency, and onset of action, the role of GABA agonists, the utility of MAC, and the hemodynamic consequences contribute to informed decision-making in clinical practice. Choosing appropriate volatile anesthetics, recognizing the genetic transmission of malignant hyperthermia, and comprehending receptor activation and hemodynamic changes associated with 4 anesthetics further enhance patient safety and the efficacy of anesthesia management. Understanding the opioid system, mechanisms of action, receptors, analgesia, indications, adverse effects, drug interactions, and pharmacokinetics. Introduction. The opioid system plays a crucial role in pain modulation, and drugs acting on this system are widely used for pain management. This section comprehensively explores the mechanisms of action of major drugs modulating the opioid system, the structure and signaling mechanisms of opioid receptors, how opioid receptor activation promotes analgesia, indications for opioid receptor agonists, partial agonists, and antagonists, adverse effects and therapeutic uses of opioids, clinically relevant drug interactions, and pharmacokinetic factors influencing opioid drug efficacy. 1. Mechanisms of action of opioid drugs. Opioid drugs exert their effects primarily through interaction with opioid receptors, particularly mu, delta, delta symbol, and kappa, kappa receptors. The major mechanisms of action include inhibition of adenylate cyclase, activation of potassium channels, and inhibition of calcium influx. This leads to hyperpolarization of neurons, reduced neurotransmitter release, and ultimately, pain modulation. 2. Opioid receptors, structure, signaling mechanisms, and ligand selectivity. Structure: opioid receptors are G-protein coupled receptors with 7 transmembrane domains. They include mu, delta, and kappa subtypes, each with distinct distributions in the central nervous system. Signaling mechanisms: opioid receptors signal through G-proteins, inhibiting adenylate cyclase, activating potassium channels, and inhibiting calcium channels. Ligand selectivity: opioid receptors exhibit selectivity for specific ligands. For example, morphine primarily interacts with mu receptors. 3. Opioid receptors signaling pathways and analgesia. Activation of mu receptors is key to opioid-induced analgesia. Inhibition of neurotransmitter release, particularly substance P, results in decreased pain transmission. Additionally, activation of descending inhibitory pathways contributes to analgesia by modulating pain perception at various levels of the nervous system. 4. Indications for opioid drugs. Agonists: opioid agonists like morphine and oxycodone are indicated for moderate to severe pain. Partial agonists: buprenorphine is a partial agonist used for pain management and opioid addiction treatment. Antagonists: naloxone and naltrexone are opioid antagonists used to reverse opioid overdose and prevent relapse in opioid addiction. 5. Adverse effects and therapeutic uses of opioids. Adverse effects: common side effects include sedation, respiratory depression, constipation, and tolerance. Misuse may lead to addiction. Therapeutic uses: opioids are used for acute and chronic pain, post-surgical pain, cancer pain, and palliative care. 6. Clinically relevant drug interactions. Opioids may interact with other central nervous system depressants, increasing the risk of respiratory depression. Some interactions may alter drug metabolism, necessitating dosage adjustments. 7. Pharmacokinetic factors influencing efficacy. Pharmacokinetic factors, including absorption, distribution, metabolism, and elimination, influence opioid drug efficacy. Variability in metabolism, hepatic function, and genetic factors can impact individual responses to opioids. Conclusion: a comprehensive understanding of the opioid system, from the mechanisms of action to clinical applications and potential complications, is essential for healthcare professionals involved in pain management. Balanced utilization of opioids, considering their indications, potential adverse effects, and pharmacokinetic factors, is crucial for optimizing patient care and ensuring the safe and effective use of these powerful analgesic agents. Exploring the neurochemical and thermoelectrical dimensions of acupuncture, insights from NIH guidelines and research. Introduction. Acupuncture, a traditional Chinese medicine practice, has gained increasing recognition for its therapeutic potential in managing various health conditions, particularly pain. The National Institutes of Health, NIH, provides guidelines that underscore the safety and efficacy of acupuncture in certain contexts. This section delves into the NIH guidelines on acupuncture use, examines the endogenous opioid peptides and neurotransmitters involved in acupuncture analgesia, explores the neurochemical effects of different electroacupuncture frequencies and intensities, and elucidates the inherent thermoelectrical properties of acupuncture needles. NIH guidelines on acupuncture. The NIH recognizes acupuncture as a complementary and integrative health approach, particularly for pain management. According to the guidelines, acupuncture is considered safe when performed by well-trained practitioners using sterile needles. It may be a viable option for various pain conditions, including chronic pain, osteoarthritis, and migraines, among others. Endogenous opioid peptides and neurotransmitters in acupuncture analgesia. Acupuncture-induced analgesia is mediated by a complex interplay of neurochemical factors. Endogenous opioid peptides, such as beta-endorphins, enkephalins, and dynorphins, play a crucial role in modulating pain perception. Acupuncture stimulates the release of these endorphins, promoting pain relief. Additionally, neurotransmitters like serotonin, gamma-aminobutyric acid, GABA, and glutamate are implicated in acupuncture's effects. Serotonin contributes to mood regulation and pain modulation, while GABA acts as an inhibitory neurotransmitter. The modulation of these neurochemicals enhances pain threshold and reduces the perception of pain. Neurochemical effects of electroacupuncture. Electroacupuncture, a modern variation of traditional acupuncture, involves the application of electrical stimulation to acupuncture needles. Low-frequency/high-intensity electroacupuncture and high-frequency/low-intensity electroacupuncture elicit distinct neurochemical responses. Low-frequency/high-intensity electroacupuncture is associated with increased levels of endorphins and enkephalins, emphasizing its role in pain management. High-frequency/low-intensity electroacupuncture, on the other hand, is linked to enhanced serotonin and GABA release, offering a broader spectrum of neuromodulatory effects. Inherent thermoelectrical properties of acupuncture needles. Acupuncture needles exhibit inherent thermoelectrical properties, contributing to their therapeutic effects. The insertion of needles into specific acupoints generates a mild electrical current, known as the skin electricity phenomenon. This phenomenon involves the movement of electrons along the skin's surface, contributing to the stimulation of nerve fibers and the release of neurotransmitters. Conclusion. Acupuncture stands at the intersection of traditional wisdom and modern science, with the NIH endorsing its potential for pain management. The neurochemical mechanisms involving endogenous opioid peptides and neurotransmitters illuminate acupuncture's analgesic effects. Moreover, electroacupuncture, with its distinct frequency and intensity profiles, provides a nuanced approach to pain modulation. Finally, the inherent thermoelectrical properties of acupuncture needles add another layer to our understanding of the physiological responses elicited by this ancient practice. As research continues to unravel the complexities of acupuncture, its integration into mainstream healthcare becomes an increasingly promising avenue for holistic well-being. Overview of epilepsy, definitions, pathophysiology, anti-seizure drugs, and related issues. 1. Definitions and epidemiology. A seizure and epilepsy definition. A seizure is a transient disturbance of brain function resulting from abnormal electrical discharges. Epilepsy is a chronic neurological disorder characterized by recurrent, unprovoked seizures. B. Incidence and distribution of epilepsy. Epilepsy affects approximately 1% of the global population. Incidence varies by age, with higher rates in children and older adults. It has a diverse global distribution. See criteria for diagnosis of epilepsy and classification. The diagnosis involves the occurrence of at least 2 unprovoked seizures. Classification is based on seizure type, etiology, and whether the seizures are focal or generalized. 2. Pathophysiology of seizures. A. Underlying mechanisms. Seizures result from abnormal synchronous neuronal activity. Membrane properties and synaptic function abnormalities, including ion channel dysregulation, contribute to hyperexcitability and seizures. 3. Mechanism of action of anti-seizure drugs. A. Molecular targets. Anti-seizure drugs act on various molecular targets, including sodium and calcium channels, GABA receptors, and glutamate receptors, to modulate neuronal excitability. 4. Pharmacokinetics, phenytoin and carbamazepine. A. Nonlinear and linear kinetics. Nonlinear kinetics, seen in drugs like phenytoin, exhibit saturation and autoinduction. Linear kinetics, as in carbamazepine, show proportional changes in drug concentration with dose. B. Elimination mechanisms. Phenytoin undergoes saturable hepatic metabolism, while carbamazepine undergoes hepatic metabolism, primarily through cytochrome P450 enzymes. 5. Process of selection of an anti-epileptic drug. A. Rationale for AED selection. Factors influencing AED selection include seizure type, patient age, comorbidities, and potential side effects. Tailoring treatment to the individual patient is crucial. B. Efficacy/specificity of AEDs and seizure type. AEDs vary in efficacy and specificity for different seizure types. Selection is based on matching drug properties with the patient's seizure profile. 6. Adverse effects, drug interactions, and contraindications. A. Oxcarbazepine, lacosamide, carbamazepine, lamotrigine, levetiracetam, valproate, ethosuximide. Adverse effects range from mild to serious and include rash, hepatotoxicity, cognitive effects, and teratogenicity. Drug interactions and contraindications vary among AEDs. 7. Discontinuing drugs. Factors to consider. Discontinuing an AED involves assessing the patient's seizure control, underlying etiology, and the risk of recurrence. Gradual withdrawal is recommended. 8. Epilepsy-related issues. Psychogenic non-epileptic seizures, PNES. PNES are episodes resembling seizures but without abnormal brain electrical activity. Diagnosis requires video electroencephalography, EEG, monitoring. B. Sudden unexpected death in epilepsy, SUDEP. SUDEP is a rare but serious complication. It involves sudden, unexplained death in individuals with epilepsy, often during sleep. Risk factors include uncontrolled seizures. Conclusion. Understanding epilepsy, from definitions and epidemiology to pathophysiology, treatment with anti-seizure drugs, and associated issues, is crucial for healthcare professionals involved in the care of individuals with this neurological disorder. Advances in pharmacology and our understanding of the intricacies of epilepsy continue to shape the landscape of treatment strategies and patient management. As research progresses, a more personalized and effective approach to epilepsy care is on the horizon. Serotonin and dopamine in neuropsychopharmacology, mechanisms and therapeutic applications. Introduction. Serotonin and dopamine, two key neurotransmitters in the central nervous system, play crucial roles in regulating mood, cognition, and various physiological functions. Understanding the synthesis, receptors, and therapeutic applications of these neurotransmitters is vital for advancing neuropsychopharmacology. This section explores the intricate mechanisms of serotonin and dopamine, focusing on their production, receptors, and therapeutic interventions. 1. Serotonin synthesis and therapeutic intermediary. Serotonin, also known as 5-hydroxytryptamine, 5-HT, is synthesized in serotonergic neurons from the amino acid tryptophan. Tryptophan hydroxylase catalyzes the conversion of tryptophan to 5-hydroxytryptophan, 5-HTP, an active intermediary. 5-HTP is used therapeutically in some dietary supplements. 2. Serotonin receptor families and coupling mechanisms. The 5 main serotonin receptor families are 5-HT1, 5-HT2, 5-HT3, 5-HT4, and 5-HT6/7. Canonical coupling mechanisms involve G proteins, leading to either inhibition or stimulation of adenylate cyclase, modulation of ion channels, or activation of intracellular signaling pathways. 3. Primary locations and functions of therapeutically targeted serotonin receptors. Serotonin receptors are distributed throughout the central and peripheral nervous systems. Therapeutically targeted receptors include 5-HT1A, anxiolytic and antidepressant effects, 5-HT2A, antipsychotic and anxiolytic effects, 5-HT3, antiemetic effects, and 5-HT4, gastrointestinal motility regulation. 4. Indications and action sites of 5-HT1A agonists. 5-HT1A agonists are used for anxiety and depression. They act in the raphe nuclei of the brainstem, facilitating serotonin release and exerting anxiolytic and antidepressant effects. 5. Migraine relief mechanism by 5-HT1B/1D receptor agonists. 5-HT1B/1D receptor agonists, triptans, constrict cranial blood vessels and inhibit the release of pro-inflammatory neuropeptides, providing relief from migraines. 6. SSRIs and mood improvement mechanism. Selective serotonin reuptake inhibitors, SSRIs, enhance mood by inhibiting the reuptake of serotonin in the synaptic cleft, leading to increased serotonin availability and prolonged neurotransmission. 7. Superior tolerance of serotonin receptor antagonist/reuptake inhibitors over SSRIs. Combining serotonin receptor antagonism with serotonin reuptake inhibition, as seen in some antidepressants, reduces side effects by modulating the balance of serotonin transmission. 8. Serotonin in the gut and CNS. Serotonin acts in the gut to regulate motility and in the CNS to modulate mood, appetite, and sleep. Dysregulation is implicated in gastrointestinal disorders and psychiatric conditions. 9. Dopamine receptors and Parkinson's treatment. Dopamine receptors targeted in Parkinson's disease are D1 and D2. Activation of D1 receptors stimulates adenylyl cyclase, while D2 receptors inhibit it, modulating motor function. 10. Mechanism of action and side effects of Parkinson's medications. L-DOPA, precursor, carbidopa, L-DOPA enhancer, selegiline, razagiline, MAOB inhibitors, talcopone, COMT inhibitor, and dopamine agonists, pramipexole, ropinirole, treat Parkinson's with varied mechanisms and side effects. 11. Cholinesterase inhibitors and NMDA receptor antagonist in neurodegenerative diseases. Donepezil, rivastigmine, and galantamine, cholinesterase inhibitors, and memantine, NMDA receptor antagonist, are used in Alzheimer's disease, modulating cholinergic and glutamatergic pathways. Conclusion. The intricate roles of serotonin and dopamine in neuropsychopharmacology highlight the complexity of neurotransmitter systems. Understanding their synthesis, receptors, and therapeutic applications is crucial for developing effective treatments for various neuropsychiatric and neurodegenerative disorders. Advances in pharmacology continue to unravel the intricacies of these neurotransmitter systems, offering new avenues for therapeutic interventions and improved patient outcomes.